CodeBlueNow is a national nonprofit grassroots organization, nonpartisan, that intends to fix the healthcare system so it works for the American public. We believe the American public is vastly smart enough to solve this problem. We need to get healthcare out of partisan politics, out of the hands of Congress and the administration, and back into the hands of the people. Actually, it's never been in the hands of the people, so we need to start there. CodeBlueNow believes it's entirely possible to have an affordable, safe, effective, efficient, and equitable healthcare system. And what you need to do that is to have a vision of what a healthcare system should do. So we believe that the healthcare system should support the health of all of our people in the communities of where we live, that people should have the power, authority, and responsibility to make their own healthcare decisions. We need to have the tools to do so. We need to focus on prevention rather than high-tech cures. If you're a licensed healthcare professional, people should have access. And we need to have everybody participate in the system. So if you're participating in it, everybody pays, the individuals, the employer, and the government. And you need to have a safety net for those people who can't take care of themselves. Those ideas came out of a contest that we did back in 2003. And here were 10 strangers who were the finalists in this contest, and they all came up with essentially the same things. In 2003, I just finished my book, The Buck Stops Nowhere, Why America's Healthcare is All Dollars and No Cents. And I was just finishing it and couldn't figure out how to end the book, and a friend of mine says, well, why don't you do a contest, Kathleen, like they do in engineering, to build a better robot? And so I thought, why not? So I put up a $10,000 cash prize, because in this industry, it's about time somebody put their money where their mouth is. And another colleague came up with $5,000. We did a contest to build a better healthcare system. We had over 100 applications, 9 independent judges. I was not a judge. And we've come up with, that's where all those ideas came from. And it's of the top 10 finalists, they all had the same thing. We have to cover everybody. We have to have a basic benefit package. It has to be affordable. The people have to participate in the management and design of a healthcare system. And that's the day after the contest we started CodeBlueNow. Well, we believe the healthcare system is fundamentally broken. You can't tinker with it. And we believe that the American people are smart enough to solve the problem when you ask them to solve a problem. So we're going to be starting systematically with the high core values that we talked about earlier, and then we're going to move into the areas where there's not common ground or consensus yet on how to manage the system and how to pay for it, and how the delivery system should be structured. And this gives us the opportunity to use the ingenuity of the American public to solve a problem. So we'll start discussing what should be covered in a healthcare system, what should be the goal of a healthcare system. So we need to start in fixing our healthcare system as the Founding Fathers started building this country. You don't start with how to pay for it overnight. You start with what is it supposed to do, and then you can get to how you manage it, and then you can get to how to organize it, and then finally, you get to how it can be paid for. The system is so fundamentally flawed that it's like a Rube Goldberg model, that if you fix something here, it falls apart over there, and it's a law of unintended consequences. And if you look at some of the candidates' proposals, I mean, all they do is, let's fix this part of the system and cover children here and do this over there, and there's so many different rules and regulations. Nobody plays by the same rules in healthcare right now. Code Blue is the code that they call in a hospital when a patient's dying and needs immediate attention, and we think that's the shape of our healthcare system. It's in Code Blue now. Common sense has never been the hallmark of the American healthcare system.